Now, for our final session of the day, we're going to continue on that theme, and I'd like to introduce Adrian Gore of Discovery Limited and Adeeb Mahmud of FSG. Adrian Gore founded Discovery Limited in South Africa in 1992 with a core purpose to make people healthier and enhance and protect their lives. Discovery is now a multinational financial services provider renowned for the Vitality Shared Value Insurance model, which incentivizes behavior change and integrates this into insurance and financial services pricing. This pioneering model of insurance is transforming markets globally, built into the offerings of leaders such as AIA, Generali, John Hancock, Manulife, and Ping An Health, representing more than 35% of the global personal protection market, with over 30 million Vitality members across 31 countries. Adeeb Mahmud is a managing director at FSG and leads engagements on corporate purpose, CSR, and shared value. He has advised healthcare companies, including Abbott, Eli Lilly, Merck, and Quest, and also others, such as MasterCard and Dow Chemical. Adeeb serves on FSG's Business Oversight Committee and co-leads our Washington, D.C. office. We will have an audience Q&A portion for this discussion, so please submit your questions using the Q&A function in the Zoom. Now I'll pass it to Adrian to share his take on the future of shared value in financial services, and Adeeb will join back in for a moderated Q&A in about 15 minutes. Adrian, over to you.
That's really great. It's a great pleasure to be addressing you, and I hope I get across our message, really trying to illustrate the power of our business model, our Vitality Shared Value Insurance model. I think trying to make the point of just its ability to shape financial services and to shape insurance, and I hope I get this across to you. Let me just get my slide out there. Thank you. So maybe I think you covered the introduction very generously, but to make the point, some context. We started out as a health insurer in South Africa, and I think the context is important in kind of the evolution of shared value, because our kind of issue was, this is at a point in the history of South Africa when Nelson Mandela was just freed in 1990 and was leading up to the first democratic elections in 1994, and we formed a health insurance company. And the strategic question was really how you could do this in a sustainable way. As you can see from the chart, our country, as you may know, has terrible levels of disease burden, HIV, AIDS, infectious diseases, non-communicable diseases as well, has too few doctors, as you can see in the middle of the chart, and from a history of discrimination has an absolute commitment to an egalitarian system, so no discrimination at all. Very much like Obamacare, no guarantee, no pre-existing conditions can be taken into account, community rating in terms of how you price health and life insurance, and so a very, very egalitarian system. And the question is, in a market like this, you can't really price risk. You're not able to actuarially really price risk accurately. At the same time, there are not enough doctors and hospitals to make a market and therefore manage the care on the supply side. And so the kind of conclusion we came to was, could we make people healthier and really reduce the demand for healthcare? And so we started out Discovery on this very simple but I think very powerful purpose that has been very enduring for us around the idea of making people healthier. And that's been our North Star. The manifestation of that on the left-hand side of the chart was the concept, as you mentioned, of vitality. It's really a construct, a behavioral construct that incentivizes people to make the right choices in a framework of know your health, improve your health, and get rewarded. So you get vitality points for doing healthy things, going to the gym, eating healthy, being physically active, not smoking, etc. Those points give you a status, so it's kind of a very simple behavioral model, and the status gives you all kinds of rewards and incentives. You pay less for your insurance, you get access to gyms, to healthy foods at discounts, etc. The critical thing in the middle of the slide is the kind of architecture of the model. The Vitality Behavioral Program underpins the institutional businesses of health and life insurance and prices those behaviors actuarially into the actual insurance. And kind of inadvertently over time, while this was kind of an actuarial or an entrepreneurial hunch in the mid-90s, what happened to us over time is we found that we actually developed a very, very pure shared value model. So by making people healthier, you create economic value. And I think the fundamental thing about health and life insurance, and to an extent financial services, we are completely aligned to our customers. If they're healthier, we are more profitable. And we can share that profit through incentives to make them healthier. And so you get, on the right-hand side, this very clear shared value model. People are healthier, we're more profitable, we share the incentives, and they go around and hopefully they do more of it and become healthier. And so it's great for us, great for our customers, great for society, healthcare systems, etc. And so you get a very pure shared value model. I think the globalization of this really was from a very local South African model globally because of three very, I think, important megatrends. The fact that we started to understand that the nature of risk of people dying, people getting sick, is very much behavioral choices people make. Just 4 choices drive 60% of mortality. It's quite an amazing thing. Smoking, eating badly, being physically inactive, and drinking alcohol leads to 4 conditions that drive 60% of deaths. It's a remarkable outcome. And our understanding of behavioral economics as to why people make those choices with over-optimism, with what we call hyperbolic discounting. They don't concern themselves about the future. We're all coded that way. And so we had to change those incentives and understanding the nature of risk. When I started out studying, risk was deemed to be pre-existing. And so we learned about the nature of risk. At the same time, the power of technology, the enabling power of technology, and then, of course, the importance of corporate social responsibility, that corporations like ours and others need to have a purpose, a role in society. And so these 3 megatrends coalesce to form a very, very powerful force globally, where our models start to really resonate. I'd put it to you that COVID has really accelerated that dramatically, and we're seeing over the last number of months just an acceleration in every respect. We're learning from the COVID data that forget about just non-communicable disease, but infectious disease like COVID is very much a factor of lifestyle choices to your risks of death and sickness. There's been a rush along on technology, and of course, corporate responsibility has really accelerated. So we found ourselves kind of at the epicenter of the opportunity. What has happened globally, I hope the slide is clear, but on the right-hand side, an analysis done by, if you look at the large life and health insurers globally, all of them, I think, are embracing this idea that risk is not pre-existing, that you can impact people by engaging them, helping them be healthier. And the manifestation of that, as you can see from the chart, is that these companies are becoming ecosystems, buying insurtech businesses, essentially trying to find out ways of how you engage the customer, how you make them healthier. And I think that, of course, is the opportunity. I put it to you, we pioneered this approach of engaging and incentivizing health and pricing it into insurance. Our Vitality Network today is made up of 16 companies, including ourselves, across 31 markets. And you can see the scale of the network. Giants like Ping On, AIA, Generali, Sumitomo, John Hancock, Manulife, and others around the world have become part of our platform. And I think we're learning about the data, the tech, and the layers of how this thing can work. And I think what's powerful about it, and I know I have limited time, and just bear with me for a moment. I think the power of it is it's completely and totally in line with our customers. As I said before, there's absolutely no dissonance. So if you think about insurance markets, health and life insurance, which are big and powerful, they have been historically very transactional businesses. The insurer charges a premium, and when you're sick or you die, unfortunately, they pay a claim. Of course, there's a lot of complexity in that. But I think the value chain that I think we focused on is the behavior change, getting people to behave in a different way, make the right lifestyle choices, and through that, creating economic value. When people make choices to make them healthier, it creates considerable value in our risk pool, but of course in broader society. But what we've done in a disciplined way is created this shared value equation. I hope it doesn't bore you, but I think it is important to understand the components of it. When people behave better, it creates economic value, and our role is to understand how to share that value per member. So on the left-hand side of this formula, the value per member, we have to understand actually and split it out into its components so we get the right equity in the process. So if you break it up, effectively the value per member can be broken down in the incentives that we give members per member, the behavior change per incentive, the second component. Critically, for the given behavior change, the difference in mortality rates, we call it the delta QX, excludes the actual formula, but essentially for the given behavior change, the third component, what is the change in the chance of people dying or becoming sick? That's the critical social issue of our model. And then finally, given the value created by that change in mortality, how we share that through product design, through charging people less, etc. But I wanted to kind of highlight these pieces because the first 2 components is really engagement, getting people to engage in the model, change their behavior. The second is really making people healthier, the data, what it shows, the correlations, the causality. And the third is, in a sense, the product design. I wanted to make the point about the first 2, about engagement. We're learning amazing ways of engaging people, getting them to make the right lifestyle choices. There are all kinds of different ways. You can see on the right-hand side of the chart through our various markets, the levels of engagement in our products is remarkable. So you get in many markets 50 to 60% of people that we cover engaging quite heavily in the Vitality program. We've worked with amazing structures and companies. We worked with Apple globally around using the Apple Watch, as a way to incentivize people. So it's an incredibly powerful device, as you would know. It's also aspirational. So it's a great example of an engagement tool in our shared value model, where in effect you get the watch for free in effect. You pay for it monthly, but what you pay is a function of how physically active you are. So if you're meeting your physical activity goals, the watch is free. So it creates kind of a loss-framed incentive and reward for people to be physically active. And you can see from the data the data that we have. We did a study with RAND that showed that across different risk factors, gender, all kinds of geographies, we found there was about 30% increase in physical activity, and that was sustained. So we're learning with the data, with the structures, how to engage people. But I think the critical point I wanted to make is our purpose: make people healthier, and that's the third component of the equation. Really, for a given change in behavior, what is the change in the mortality rate and the chance of death or sickness? And the data is incredibly compelling, and I think that's what makes the shared value model so powerful. You can see on the left-hand side, we're now understanding the correlations between people engaging in the program, from no vitality to a goal vitality member. You can see all of the chances of sickness or death going down, regardless of disease type. Amazingly, in the middle of the chart, the COVID data coming out is incredible. So people who are heavily engaged in making the lifestyle choices have a 70% or higher chance of lower chance of death or sickness from COVID. So this is a very powerful model against infectious diseases. And then the right-hand side, I thought I'd show some causal data. In other words, not just correlated data, but in fact, people becoming more physically active. And as you follow them over time, longitudinally, you can see that the healthcare costs and the mortality risk come down. So the data is remarkably powerful. Where we're heading to now in the model, and I think it's very important to make this point, is that we are developing a very powerful data set globally, 50 million life years of data, to understand exactly lifespan, or what we call health span. So we're rolling out for the first time this idea in a very predictive layer of understanding different metabolic risk factors and understanding per person in a very accurate way what is the expected lifespan of an individual, what is their health span in green. In other words, how many years have they got ahead of them that are healthy, what is the health span gap, and what diseases are they likely to get. And I think the power of this model is, hopefully it's intuitive to the customer. It tells you how many healthy years you've got. But you can see on the right-hand side of the chart, we can also offer from the data, what is that one next best action that you should do that will have the greatest effect on lengthening both health span and lifespan. It could be physical activity, it could be medicine adherence. We're learning more and more how to do this. I wanted to show some data. In my own case, I'm a male, 57, excuse the actual terminology. I've been very good on vitality, but we kind of backsold this on a 57-year-old who's not following a very healthy regime, smoking, an ex-smoker, not eating well, not following his prescription medication. You can see on the right-hand side a health span of 16 years and a lifespan of 21 years. Amazingly, he's just doing a few activities, being more physically active, sticking to your medicine. You can see the health span grows from 16 years to 22 years. It's a remarkable result. What's showing us is that health is highly elastic to behavior. So just a few activities can really drive up both lifespan and health span. I think what's amazing about the data is that it's conclusive across different ages, different genders. It really is about making people healthier. This is about real equity, where in effect, regardless of your state of health, you can really affect your health span. So health span is very elastic and can be changed, number one. Number two, through one or two activities, that change can be dramatic. And you can see on the right-hand side of the chart, in this case, a 70-year-old female hasn't lived a healthy life. It's never too late. You can see by doing one or two activities, this individual could change their health span from 6 years to 11 years, or nearly 12 years, nearly doubling of health span. So the potential to make a difference to society is remarkable. For us, of course, it creates a very different shared value insurance model across the value chain of what we do. Our whole view now is about predicting illness. We have the data now to predict illness, to value it, and then to intervene and incentivize people in the right way, to make the right lifestyle choices, to incentivize financially and through guidance and education and all kinds of digital therapeutics to get them to intervene. The effect of this can be dramatic. In a sample in one of our risk pools, we predicted 33,000 people who would be diabetic. So it's the prediction pool. They have considerably higher health and mortality, death risks, and our ability to reduce that risk is dramatic through these kinds of tools. So the shared value model, I think, has tremendous potential, obviously, in health and life insurance. And I think, as we are doing in other industries as well, you have a similar kind of behavioral biases with just a few behaviors that make a dramatic impact. So through the Vitality shared value model, I think we've created a kind of repeatable, scalable model that can, of course, create strong institutions, but the whole issue of shared value, creating economic value, making people healthier, and hopefully changing financial services in the process. Sorry, I've taken too long, Adeeb, but I hope
no worries, Adrian. There's such rich information here. I feel like we could have easily spent an hour on each of your slides. And I want to thank you, first of all, you and other colleagues at Discovery, because you all are demonstrating through such a powerful and compelling model how shared value can work in real life. And Adrian, for discovery, shared value is not about just a single initiative. It's not just about doing one pilot, right? You've built your entire business model based on shared value. And as you were sharing a few minutes ago, when your customers are healthier, make more profits, and it creates that virtuous cycle. And one of the reasons, of course, we think shared value is so powerful is that it can be scaled. And while you started working in health, you're now applying shared value to other areas like financial well-being and even the environment. So I'm wondering if you can share with us a little bit more about how are you thinking about those other areas beyond health?
Well, I think the important issue, and I think you've raised it, is the consistency in the fact that just a few behaviors lead to better outcomes, health-wise, planet-wise, etc. We find the same thing in driving, just a few driving behaviors, speeding, accelerating through corners, a number of things we've tracked that lead to fatalities. We found the same in banking, in terms of financial wellness. There's a few things in terms of unsecured debt, not saving for retirement, etc., lead to all kinds of financial difficulties. And the same in the planetary issue, in terms of the planet, driving, traveling, eating the wrong foods, electricity that you burn, etc. Those individual behaviors lead to the climate problem. So we've applied exactly the same model in the case of banking. So Vitality Money effectively incentivizes and guides people to manage their money better. The same structure works in exactly the same way, and they get powerful benefits in the banking system. So they pay a low rate of interest on borrowings, they earn more on savings. So it really kind of, the model we're trying to get to is talking to the very value proposition that people value in that particular industry, but using the same kind of behavioral tools, the same structure and architecture, and we're applying it to motor insurance, banking, rolling out this concept of Vitality Green, of trying to incentivize better behavior in terms of the climate. And again, making the point of, I think if we get these adjacencies right, the ability to really transform financial services for the good. And there is no dissonance. I think that's the powerful issue.
Adrian, there's a question from the audience that I'd like to explore a little bit more. This person is saying that this is a fascinating model in terms of how incentives can inspire healthy behavior. Can you comment a little bit about how you see this model applying to people who are in low-income communities or marginalized populations? For example, if someone isn't going to be buying or wearing an Apple Watch, and just to expand on that further, I think what you mentioned about the transition of South Africa is important here as well, right? That you're not discriminating based on any pre-existing conditions. So the system is egalitarian, yet at the same time, we know that socioeconomic disparities exist, whether it's in the US or in South Africa. So when it comes to healthy access to healthy food, for example, people aren't all in the same boat. So can you comment a little bit more about how you think about those disparities and inequities?
Yeah, absolutely. I think it's a crucial point. I mean, the first point to make is that the program is not about healthy people, it's about making people healthier. And in fact, the data shows that the sicker you are, the older you are, often these behavior changes are more powerful. So this is really about a program aimed at all risk factors. In terms of income levels, it's important to say that the fundamental issue of this model is to bring the price of insurance down. So by getting people to change their behaviors, to make the right lifestyle choices, it actually brings the cost of health and life insurance down. So it creates more access for people. And intuitively, you would expect, and it's difficult to get there simply, but intuitively you would expect that financial incentives have a greater impact as you go further down in terms of lower income. In our own market, we have to grapple with massive levels of inequality. So we're trying to bring down the cost of insurance. We're trying to make financial incentives crisp and clear that hopefully have even more value lower down. So obviously the Apple Watch is a sophisticated benefit, we're using in markets like North America, etc. But in simple markets, markets where there's a simple issue about access or not, the fundamental issue of the model is to try to bring the cost of coverage down. I think that is the social issue. If we can achieve bringing the cost of coverage down, regardless of state of health, and we can make people healthier, I think the shared value equation works well. We are stronger, we provide greater access. So this is about equity, but translating it in different countries and different cultures is something we're learning. It's not a simple thing. So no hubris here. I think we're on a learning curve, frankly.
Adrian, one final question before we end. You mentioned that there is no dissonance as you're practicing shared value. And when I'm talking with companies that are exploring shared value, there's a couple of challenges that they usually bring up. One is that by combining social impact with generating profit, there's a perception that it may hurt our reputation as a company. And the other challenge that I hear about, and this is true especially for healthcare companies the perception that, hey, we're already doing shared value because we're making profits. Have you dealt with either of those challenges in your work? And how, is there a tension that you feel between generating profits and creating social impact?
Look, I don't believe that. I think that firstly, I think having a defined, authentic purpose is fundamental, and I think the purpose needs to resonate for good for society. Our simple idea of making people healthy has been the cornerstone of that. So we've been proud of that from the get-go, even before companies were speaking about purpose to an extent. But I think the strength of the model, I guess any business should not have a dissonance with its customers. And in ours, it's a pure form. If people are healthier, we are more profitable. So, in fact, if anything, I think the shared value revelation for us has been the better we do this, the more we share value, the lower the cost of our products, the more competitive we are, and the more profitable we are. There's no issue to it. So it really is a fundamentally powerful business model. There's no dissonance at all. I mean, I'm not sure, there may be businesses where you are fundamentally at odds with your customers. I'm not sure that's a great business to be in. In the case of healthcare, to your earlier point, I guess I would say to you that you may be making profits, but I think shared value is when you get a change, to the extent you create economic value through the model, and then you share that value. So no criticism. Profit, of course, has all kinds of, I think, good things associated if it's done for good. But I think the model is powerful if you can create change, and the change creates economic value, and that value can be shared. So I think we have a pure translation of that in the markets we're in. And I think in most of the stuff we're doing, from banking to motor insurance to property and casualty, there is no dissonance. And I have a deep conviction, I think our team does, that there should be no dissonance, and we should be proud of this concept of shared value. I think it has the potential to take capitalism to a different dimension where it's not seen as at odds with society. Quite the opposite. It underpins, a functioning society.
Got it. Thank you. Since we do have a couple more minutes, there's two other questions that are a little bit more specific to your model, and maybe you can choose which one you want to answer if we don't get to both of those. But I'll mention both of the questions to you, Adrian. One is, someone asked, what are your inputs for measuring health span? The other question, another participant asked, was, how do you think about data ethics and surveillance, especially of vulnerable populations? Are they informed about data privacy and data choices?
So the first point is that I think we treat data with considerable respect. Data is only used for good in our model. It's only used to incentivize better outcomes, better value. So in every market we've been in, from complex markets like California, New York, to Germany, to different markets that are different, it's never been an issue being clear. We make sure we comply with laws, data laws. All data is anonymized. So despite the considerable granularity of the data, we've never had an issue with it. And we regard that using data for good as a very important principle. To your second question, how do we measure health span? It's a complicated model that effectively takes an individual based on their risk factors and predicts forward all the metabolic risk factors, almost creating a mortality risk per year, right? And it works out kind of a probabilistic disability adjusted life year measure. So you can work out the probability of good years and then sick years and translate that into something people understand. So it's a pretty complex process. We use the global burden of disease to localize the data into different markets. But I think it is probably the most comprehensive tool out there now, and it forms the core of our kind of personal pathways for individuals. So it's a complex calculation, but in fact for the customer it's simple. Here's your expected lifespan, your health span. Do one thing, be physically active, and this is what will happen.
Thank you, Adrian. I encourage participants to dig deeper into the Discovery story and what they're doing. And again, thanks to you and colleagues at Discovery, Adrian, for showing us through stories, through data, and through your example of how shared value can work in practice. Thanks for your time today.
Thank you.